You guessed it, Medicare is on the minds of senior voters in Florida.
It's a lifesaver to me.
The way it is now, I feel I'm taken care of by Medicare.
I want Medicare preserved in the form that it is.
But here's the problem. Medicare cost us $549 billion last year, and that number is only supposed to grow as more and more baby boomers become eligible over the next 2 decades. So what do your presidential candidates want to do about it? Former Governor Romney wants to give Americans under the age of 55 a set amount of money so they can buy private insurance. They will also have the option to use that money to buy traditional Medicare coverage.
The word privatizing scares me.
The Republicans want to use vouchers, and that's not for me.
He's been clear that his plans won't affect current Medicare recipients, but some we talked to are concerned future government payments won't keep up with skyrocketing health care costs.
Seniors are really interested in their children and their grandchildren, and they want what's best for them. They don't want to just have it for themselves.
President Obama took a different approach to controlling costs in Obamacare. He agreed to cut $716 billion over the next 10 years of what he says is waste. It will lower direct payments from Medicare to healthcare providers. Also cut would be money paid to private insurance companies who operate the Medicare Advantage program, which is costing the government an average of 14% more than regular Medicare.
There has to be a limit on what the doctors charge, and that's why Medicare is going broke.
But Dr. Charles Stewart, an orthopedic surgeon in Boca Raton, says payments are already lower than they used to be.
Give you an idea, when I first started doing knee replacements in 1978, I received $4,000 for a knee replacement. Now my reimbursement is $1,400.
He says what you see on your bill is not what the doctor gets paid, and he's worried doctors will stop accepting Medicare patients. But another way to cut costs, often not spoken about, is to cut unnecessary care.
We know of services we can get sometimes by speaking to other people. As long as it's all covered, I try to have every prevention possible.
I spend probably an hour every day talking people out of tests.
A rare confession, since doctors get paid for those tests. Seniors in Florida spend more Medicare dollars per person when adjusted for age, sex, and race than in any other state.
Probably a third of my patients in Medicare don't need to see me. They come here for social reasons. They get to see their friends in the lobby, they go out for tea, they get dressed, they like coming in, they bitch they have to wait too long, but they're here because, truthfully, they don't have a lot else to do. Now, I may be cutting my own throat because I get paid to see those patients, but that's a major problem for us. I'd rather see patients that need to see me.
But Dr. Stewart confirmed that optional tests are often done because MDs are concerned about medical malpractice lawsuits. And seniors have no disincentive to visit the doctor because it usually costs them very little to nothing at all. Reforms in these areas could help cut down on unnecessary care. It's estimated that $250 to $800 billion a year is spent on overtreatment in the U.S. But don't expect any new proposals before the election. Curtailing treatment, however unnecessary, will be one of the many difficult political decisions to make about Medicare that could anger both doctors and seniors. For CNN Money, I'm Jordan Malter.